Charlie Fisher.
Here by video, and I'm gonna have to step away for about a half hour at 10, just so you know.
Okay, thank you for the heads up. Ron Gallinat.
Here by video.
Thank you. Paul Harmon.
Here by video.
Lindsay Hopper.
Here by video.
TK Keene.
By audio, I'm going to need to jump in and out of this due to some legislative demands. Thanks.
Thank you for the heads up and sounds good. Thanks for being here, TK. Kathleen Ork.
Here by Zoom.
Thank you. Claire Pierce-Roble is not able to join today. Om Sakinai.
Here, Zoom.
Thank you. Nishoba Temperley.
Here by video.
And I see also we have a couple of new faces, our new members. We have Matt Woodbridge. Are you here?
Here by Zoom.
Thank you. Alina Ziburin. I'm so sorry about the last name.
All right, yeah, here by video. Hi.
Thank you. And Dr. Catherine Seuss, are you here? Okay, Lindsay, we definitely have quorum today.
Awesome. Thanks very much. And welcome to our new members. Thanks so much for being here. I think we should move next to approval. No, excuse me. I think I went in the wrong order. I got to get my materials up. But Chicky, did you want to speak to this?
I did. So first and foremost, thank you to Stacy, Charlie, Paul, Lindsay, Om, and Nishoba for signing up for another 2 years with a HIMAC. I know there are some of you, but I believe this is your third consecutive term. So thank you so much for hanging out for another 2-year adventure, which will probably be the most eventful 2-year adventure of the HIMAC in the history of the HIMAC since 2015. So thank you so much for signing up for another 2 years. We're pretty excited that you said yes to serving on this committee. And on the right side of the slide, you will see that we, my apologies for my typo, that's Dr. Catherine Souza. And then we have Matt Woodbridge and Alina Ziburin. Alina, at some point, I would love to have help with your last name. I hope I'm not doing too badly with it. If you want to tell me now, that would be fantastic.
You can just say Elena. That's fine.
Alina, okay, all right. I will practice it, so hopefully I will do better next time. So we have 3 new members joining us, and then we have 6 new reappointments. So thank you, everybody, for joining the HIMAC. Again, so our new members, their official terms per the governor's office doesn't start until March 1st, but thank you anyway for joining us today and joining the meeting.
Right. Next, we're just going to cover our meeting guidelines. These have not changed, but extra important to go over them with new folks. So again, thank you for your time and for being here. Our commitment and our goal is really to safe and inclusive meetings. We're here to bring different perspectives, experiences geographically in the work that we do and how we serve. So there are no bad questions or silly ideas. We'd really like to hear from everyone. If you can, please raise your virtual hand, put it in the chat. I know that doesn't always work. Some of us have different functionality on this platform than others, depending on our tech. Please just do your best. We also have ongoing real-time interpretation. I have to remind myself of this, but I'm trying to speak at a moderate pace so that we can stay synced. It also helps to introduce yourself when you ask a question. And then if you are comfortable and able to do so with your technology, please be on camera if you can. It's helpful. And please mute your speaker when you're not, your mic when you're not speaking, so we can cut down on the background noise. As Chicky called the roll, we'll do that for votes so they can be logged. Next slide, please. If you are here as a member of the public, please be sure to hold questions or comments until our sessions. There's 2 of them. And then just want to emphasize that if you witness or personally experience any unacceptable behavior, please let Chicky know. We certainly need to address that immediately and want everyone to feel safe and supported and contributing. Next slide, please. We're going to move to the minutes. For the minutes in the packet, is there a motion to approve?
I'll move approval of the minutes from the previous meeting.
Thank you,
So,
Ron.
yeah.
Thanks, Ron. Is there a second?
Move to second. This is Nishoba.
Thanks, Nishoba. Any comments before or notes, questions, etc. before Chicky calls the vote? Okay, Chicky, would you please call for the vote?
I would be happy to, and I will call the roll for voting for those members who were active during the December meeting. So, Marin, how do you vote?
Yes, approve.
Thank you. Stacy, have you joined, and how do you vote? Charlie, how do you vote?
Yes.
Thank you. Ron was first motion. Lindsay, how do you vote?
Yes.
Thank you. TK Keen, how do you vote for the minutes?
Yes.
Thank you. Kathleen?
Yes.
Claire is not available today. Om, how do you vote for the minutes?
Yes.
Thank you very much. And Nishoba, you were the second motion. So the minutes are approved, the December 4 meeting.
Thank you, Chicky. I think, and I am going to navigate over just to see, but I think we are, yes, headed to our open enrollment report. Is everyone on? And if so, could you please take it away?
All right. Hello, I'm Cable Hogue, the business policy and data advisor for the marketplace. Quick overview of open enrollment, and just a heads up, with the exception of total plan selections, all these numbers are approximate because CMS has embargoed all the other data until they release it publicly. Generally, that's been late March, early April. However, other things have changed and been pushed out later than normal. So just a heads up in case you don't see the official numbers that early, it's not going to be too much of a surprise, but hopefully I'll be wrong. All right, with that, you can sort of see a high level of the difference in metal tier enrollment this year. Again, those are approximate, but as you can see, folks in the more expensive plans definitely transitioned to the bronze. Even though we saw a decrease in total bronze enrollment, it was much, much less than the other two metal tier levels. We can go to the next slide. All right. The small dip in new consumers, almost the same amount of returning consumers with an active plan selection. So folks who did return that were previously enrolled were pretty active in choosing a plan, and that reflects in the next. Pardon? Oh, okay. I must just have heard some feedback. And that reflects in the next sort of returning auto re-enrollment. That number is the lowest we've seen in several years, and I think there's a couple factors, the biggest being the loss of the enhanced tax credits, which is sort of reflected in kind of every category. You know, folks saw a pretty big increase, as you can see in the premium and APTC columns over there.
Cable, you are on mute for us.
Yep, we lost your audio. Still no. Any chance you double muted somehow? I'm guessing he is dropping and rejoining.
Okay, so in the meantime, this is again Chicky Flowers, director of the marketplace. I'm happy to pick up, and then Cable, when you're able to join, please jump back in. Okay, so what you have in front of you are comparisons of open enrollment 2025 in the blue section with OE 2026, the one that just recently concluded, in the pink section. Again, as Cable mentioned, Most of the numbers in the pink side are approximate numbers because we do not have final numbers yet from CMS. The total enrollments, though, you can definitely see that there's a difference between OE 2026 and OE 2025. New consumers, of course, not surprisingly, has also decreased. Returning consumers with active plan selection seem to be pretty strong, with only a 5,600 decrease from the previous open enrollment. And then also returning consumers who are auto-enrolled also, there's a decrease, of course, not surprisingly, but not as big as we initially thought. Again, so just the numbers in front of you pretty much show how this open enrollment went, and a lot of it's, of course, the decrease in enrollment, we contribute that primarily to the expiration of the enhanced premium tax credits. As a reminder, that expired in December 31st of 2025. And that conversation is still ongoing with Congress to determine if they will bring it back to some degree. The average monthly premium, not surprisingly, with the expiration of the EPTCs also increased. And average premiums after APTC definitely increased as well. Cable, I can see that you are hopefully finally back online with your audio. Did I miss anything about the slide?
I couldn't hear you, but from what I gathered, can you all hear me now?
We can. Okay.
Can you hear us?
That was weird. I can hear you all fine. I just had to disconnect my phone audio and reconnect it. So hopefully we're good.
Hopefully.
And it sounded like you left off at the premium changes.
I left off, and I think we can move to the next slide.
Perfect. Let's do that. All right. So here's a little bit of information on some of the FPL and enrollment by age group. As you can see, the under 200%, not a big surprise there with the BHP, some folks that had stayed on the previous year with the loss of those enhanced premium tax credits, probably decided that moving to the BHP was a more financially sound option. 201 to 500% FPL, again, anybody over 400 lost all of the tax credits they were receiving, and those in the 201 to 400 all saw, lower financial assistance amounts. So nothing too shocking there. And I think the one area we saw an increase, the not requesting financial assistance, is probably folks who could afford to pay the premiums with either the lower APTC or no APTC, and are hoping that maybe there'll be some sort of legislation that reappoints those enhanced tax credits and they can recoup those around tax time or start applying them when those are allocated, if they are allocated again. Age ranges, again, the younger 18 to 34, the big decrease there. Not too shocking. Those are the folks who I think generally either are more healthy or believe they're healthier and don't feel they need insurance as much as other folks. And so that's where we saw a large decrease in, the enrollment was that age group, which was a significant portion of our enrollments that we did not capture. And we can go to the next slide. Okay, so this is transitioning over to our partners. Before that, are there any questions about the kind of high-level enrollment data points? All right, I think I will turn it over to Michael and Aditya to take it away for the partners.
Good morning, everyone. As you might imagine, it's been a challenging year. And so some of the information that we've gotten from our partners that kind of speaks to what they've experienced and seen, boots on the ground, have been around the confusion and concern that have been felt by clients. Just a lot of federal uncertainty specific to the expiration of the expanded premium tax credits. that in addition to other things leads to the sticker shock that folks were experiencing with the decrease in APTC, and then of course the rise in rates. It definitely put a lot of concern into the hearts of clients. Changes in carriers participation, plan offerings, and then network changes was also a concern. Clients typically in the higher income ranges were no longer eligible for APTC. And then, of course, some of the clients in the lower ranges ended up merging into Bridge. In the end, it really led to an increase in work specifically for insurance agents, and I'm sure for our community partners as well, and a decrease in marketplace enrollments. So it really was a tough deal, but I'm really heartened by the work that the agents and community partners do, regardless of the challenges we face. They continue to put the Oregonians first and really are all in on making sure folks get in the coverage that they need, regardless of what that looks like. And while that does leave some folks without coverage, which is heartbreaking. Hopefully we'll see some changes, in the future that can help resolve that. Next slide. So I'm going to turn it over to Enadina here.
Thank you, Michael. Good morning, everyone. Enadina Lopez Paz, the Marketplace Community Partner Liaison. So yes, as Michael was saying, for grant year 2025-2027, we have 13 community partner grantees who are doing amazing work throughout the state of Oregon, helping consumers navigate health insurance with confidence and trust. I cannot stress that enough. Trust is the key, like being able to help consumers wherever they are each step of the way. Having that trust is key. So our grantees have conducted outreach to over 925,265 individuals from communities of focus as of December 31st, 2025. And it hasn't been easy. So grantees have faced unique challenges. So again, with the building trust, if when they're new grantees trying to make ways into the communities that they're serving. So it takes time, and also addressing fears. And what I mean about fears is our political climate. A lot of consumers found it difficult to attend events and such things. So that is what a lot of our grantees have worked towards, addressing those fears. And again, working within strict guidelines, meaning that they can only provide choice counseling versus plan advice, which an insurance agent can provide. So again, knowing when to make those warm referrals to an insurance agent. So that is some of the things that our grantees have faced. But despite the hurdles, grantees remain committed to empowering consumers with accurate information. And as we can see there, we have Asian communities, Latino, Latina, Latinx communities, people living with HIV, immigrant communities, Russian, Ukrainian communities, the LGBTQIA2S plus community, rural, farming, Black, African, diaspora communities. So our grantees are helping a wide variety of community members throughout the state of Oregon. So their reach is far and wide. Next slide, please. And also, here they are, in case you weren't aware who our 13 grantees are. They are spread out throughout the state of Oregon, again, targeting different regions, providing that support that it's needed in our state. So again, I won't read them, but there are our 13 grantees. And yes, please, next slide. And again, as mentioned, as Michael mentioned, the rising cost, fear of immigration enforcement, and mistrust of federal systems have created significant barriers to health coverage. But again, that doesn't stop our grantees from finding ways to reach consumers where they are at. And also, they remain committed to providing that accurate information and fostering trust, empowering individuals to make informed decisions about their health care. So again, those numbers that we are seeing, they are accurate as of December 31st, 2025. So I will have final numbers by the end of this month to reflect how all of that amazing work that our grantees have been doing, assisting Oregonians throughout the state of Oregon. So I believe that is the end of my presentation, and I believe it goes back to Michael. Thank you.
Yeah, thank you, Anadina. So yeah, as Anadina mentioned, just couldn't be happier with the performance of our partner grantees and certainly agents and community partners more broadly as well. But so this year we had 24 partner agents. They have office located throughout Oregon. So really pretty good coverage, and we'll cover that in a slide to come. There's been outreach conducted, events attended rather, and we know that there's going to be thousands of consumers that were enrolled by our grantees. As Anadina mentioned, we're still working on those finalized numbers, and that'll be for probably next month's HIMAC available there. So happy to provide that at that point. Most of the counties in Oregon are being served by grantees, whether that be community partners or partner agents. You can see here some of the specific communities served by our partner agents include the Asian communities, Latino, Latina, Latinx communities, LGBTQIA, 2S plus communities, immigrant communities, rural communities, and farming communities. That's just some of the many that are served. In addition, we have about 45% of our partner agencies that have bilingual assistance available on site. So something I'm really proud of. I think that really building that out to make sure that we're making access better for folks across the state to find help with finding coverage. Next slide, please. So, as Anadina mentioned, I won't read through all these, but this is a listing of our current partner grantees on the agent side. You can see there's pretty good coverage across the state. As has been kind of a bugaboo for years, the southeast corner has been a little tougher to get that grantee support, but we've got a number of agents that do serve that area. And then, of course, we have some overlap with our community partners as well, which is fantastic. And I think that might be my last slide. And I just want to just end with just saying the collaborative spirit of our grantees and the partners that we have has been so appreciated. And I can't say enough about how proud I am that despite all the challenges that have come our way as a marketplace, they stay committed and they really are doing right by Oregonians. So I'm going to leave you with that and turn it back over.
Thank you, Michael. And I believe, Marin, you had your hand up.
Yeah, thank you, Chiki. Just a quick question. Thank you, Anita and Michael. Good job. So you would have data in terms of how it impacted certain ethnic groups then? So you would have data saying that, okay, Latinos went down by a certain percentage, African Americans a certain percentage. Would you have that data or no? In terms of how that impacted certain groups, vulnerable groups?
This might it's a great question, Marin. This might almost be better directed to cable, but I'll take a stab at it. I don't know how granular we'll have as far as data that will indicate the effect of, let's say, enrollments on specific communities necessarily, but we will be able to show an overall change from year over year. Cable, can you?
Yeah, so sorry, I caught just the part of that, the impacted groups as in like the demographics, or can you expand on that just a little bit for me?
Yes, Cable. In terms of the demographics, in terms of certain groups, the impact of the federal changes in terms, for example, certain ethnic groups were impacted more than others, or certain vulnerable groups. Do you see a big drop in these groups in terms of enrollment?
Yeah, so when the public enrollment or public use files, which capture enrollment, are released, they will have a breakdown by demographics, age, and sex, gender, I should say. And so it'll give us a little bit of an idea in that regard. But as far as impacted groups that don't kind of tightly fit into those, race, ethnicity, gender demographics, there's not going to be any additional information. I will say, this time next year, we won't have to give you rough estimates of numbers. I can answer all of these questions because we will actually own our own data and have the right to release it. So I'll be able to answer those questions a lot more definitively and with hopefully quite a few more categories to give a better kind of picture of how enrollments have changed and been impacted beyond just those tightly kind of federally required race ethnicity demographics. So don't think we have it in any of these slides. No, but we will, when the data is released publicly, we'll be able to tell you kind of the change in race, ethnicity, and gender enrollment, and if there's any kind of major differences. I will say off the top of my head, from the data I have seen, it's been pretty evenly across the board. We haven't seen one specific race, ethnicity be a bigger change than all the other sort of race ethnicities. It's been pretty evenly cut across the board, mostly, financial. That's where we've seen it. It's been the income levels that have seen the biggest changes, and that's kind of been spread out across all race, ethnicities, genders.
Thank you, Gil.
It looks like we have a couple more questions. I think, Charlie, I saw your hand.
Yeah, thanks for the great presentation. Maybe this is like a more macro question, but I'm just curious, how can you remind me how the partner grantee, or how we find those groups and kind of the process for them becoming a grantee?
I'll let Michael and Nadina take this one.
Yes, so I can answer a bit. So basically, they maybe correct me, Chicky. I'm new to this role, so I don't want to say something wrong because Michael will be more. But basically, we send out a request for proposal. So grantees who are, or community partner organizations who want to apply for the grants, they do go through the process of vetting. They tell us what they do in the communities, and that's how we make those selections of who we select to be grantees with the marketplace. And again, it takes a lot what involvement you have in the community, and also as we see the need growing communities, especially Latinx speaking communities or the Ukrainian Russian communities. So if we have grantees in that area, we would put some focus on that to get those grantees onboarded to become grantees with the marketplace. So I know it was pretty broad. I don't know if Michael is back or if Chiki would like to provide some insight.
So my insight is Michael is back, I think.
All right. Thank you so much. My apologies, everyone. I, for some reason, got dropped out of the Zoom. So I am back. And I do have to apologize again. I'm not exactly sure where we just left off there to be able to take that forward. So I heard talk about the RFGP process. Was there a specific question around that?
Oh yeah, I was just curious. Well, I guess I'll say why I'm asking. Looking at the list, I mean, it's a great group of organizations. And at the same time, I feel like the part of the state that may be distrustful of government, like from a conservative perspective, isn't really covered in those groups. And I mean, for whatever you feel about those views, I think that's a group that probably isn't inclined to try to go to the government to find insurance benefits. And so I just wonder if that's something that we think about, and if there's a way to try to, I don't know, in addition to the current set of grantees, trying to find trustworthy messengers that also speak to that population.
Yeah, no, that's a great point, and it's definitely something that we do consider, and we've actually made some strides. We've got some terrific partners, as an example, on the east side of the state, and while it looks like it's really centric to the northeast side, these partners really serve much of the east side in its totality, and so we really spend time thinking about ways we can engage with folks that like may not have the same level of comfort with regards to utilizing, working with the state or utilizing state programs, whether that's, politically focused or otherwise. We do really look at that as how we reach those Oregonians. And so, as an example, we've got a tremendous partner in Enterprise, Oregon, that does great work. And I know they don't do it just in Enterprise, right? They serve a lot broader group than that. And another great partner in LeGrand, Oregon, as well as Hermiston, and I could go on. And so, while they may physically be located up north, I think that's partly just a geographic thing because that's typically where the larger centers of population centers are. So, it's a little bit deceiving looking at the map this way to kind of see that we do still have a focus on the east side, and we definitely want to make sure those folks feel like there's access and that we hear them. So definitely something we consider, and we always look to try to include folks in our RFGP process. So hopefully that's helpful.
Yeah,
That is. Thanks a lot.
I'll add specifically for the community partners, those are just like the home base locations. They do serve much larger areas and do go to events. For instance, Neon goes to events all over northeastern Oregon, not just that little office location that you might have seen on Ed Medina's slide. So this is not an entirely accurate picture of how the coverage is spread out, but just sort of where their home base is located for their offices.
Yeah, thank you for adding that, Cable. So if we go back, if you just wanted to see basically for our partner grantees, as Cable said, and as Michael, these are mainly their like home-based locations, but they do cover throughout the state of Oregon. And as I mentioned, they do work with our insurance agents too to make those warm referrals too. So maybe they're at a community event and the consumer lives in another town, when they have those connections and they're able to make those referrals. So we do strive to cover the whole state as much as possible. And again, it all depends on who applies for the grants. So yeah.
Looks like Kathleen has a hand up.
Yeah.
Yeah, sorry. Having a difficult time coming off mute. I'm just curious, it was kind of to dovetail off of what Charlie had asked, except thank you for going back to this slide. Are you finding that there are pockets of the state that are predominantly uninsured or using like a group type of insurance policies? And when I say that, what I refer to is like I know specific church or faith-based groups will come together to do like a shared type of insurance where they put into a pool of money to help cover each other's costs.
I can jump in on this one a little bit. So unfortunately, the data we get from healthcare.gov doesn't give us a super great idea of where the uninsured are. We partner with an organization called SHADAC out of the University of Minnesota, and they do an analysis for us every year based on the reported enrollment by zip code. And they use census data and American Community Survey data to kind of come up with estimates of where the uninsured are in Oregon for us. Again, it's not a perfect sort of, yes, this is exactly where they're at, but based on those community surveys through the Census Bureau, they take the reported uninsured from areas and then use our enrollment to kind of come up with an idea of where they might be. And I will say that generally speaking, as far as total kind of uninsured, the kind of Portland, Clackamas County, Washington County area has the highest number, and I think naturally that's because that's where the most people live. An interesting county we found is Deschutes County has a higher number of unenrolled. Now, to speak to the share of folks who might be eligible that are unenrolled, it's a little harder to sort of suss that information out. But generally speaking, those are kind of the two areas where we have the highest numbers of uninsured. And maybe in Deschutes County, since it's not quite as populated as those other counties, you might say that there's potentially a higher share there. In Eastern Oregon, the numbers aren't as high, but again, the population is much lower. So it stands to reason that maybe the share is a little larger over there, even though the total unenrolled or uninsured might not be as high. But again, as we get our own data this coming year with our own technology, we'll be able to better track where people are coming to the marketplace from, whether that was they had employer-sponsored coverage, quit their job, lost their job, whatever the case, and are moving into their own plan, or if they're leaving, we'll have an opportunity to sort of ask survey questions as to why they're leaving. Did they get a job? Did they just find it was too expensive? Are they moving to, like you said, a faith-based health share organization? Unfortunately, we don't have the data as to where people are coming from and where they're going with our limitations currently. I will say I hope they're not going to those health share organizations, because that's not insurance and it's not allowed to be regulated by the insurance regulators. So they sort of can tell you that they're going to pay something, but if they don't have the money and decide not to, they can sort of just do that, unfortunately, and that's just not something that current law allows our partners at DFR to regulate and tightly enforce. So I wish I could give you a better answer, but based on the data limitations, that's about as far as we've been able to take it to this point in time.
It's good information. Thank you so much.
Appreciate the questions. I think we probably got to jump to our next topic. Chicky, was there anything else you wanted to say here before we move forward?
Only that once, and hopefully when we get the public information from CMS, we'll be able to provide you with better numbers or maybe some better information. And again, the timing, normally we would come to you in April with that information, but they haven't exactly been sending information in a more timely fashion. So again, with the hope of April, if not in the summer, we'll give you the information that we receive from CMS.
Okay, thank you. Obviously, for obvious reasons, lots of interest. Okay, thanks everyone. And jumping over to the legislative session update, please.
Yeah, good morning, everybody. My name is Mary Beth Milieu, and I'm a senior policy advisor with the Oregon Health Authority Government Relations team. And I'm just going to give you a little overview of legislative session this year, what we've seen, and how things are going. So a little bit of a brief overview. In even-numbered years in Oregon, we have a short session in our legislature, which means they only have 35 days to get through all of their legislative duties. Legislators have a limited number of bills. They can do 2 personal bills, and then they can have committee bills. And agencies like OHA don't introduce any concepts in a short session. So go ahead and go to the next one. So here we have the key deadlines for this session. Like I said, it's a short session. When you're living in it, it feels ridiculously long and every day feels like a week, but it goes by very quickly. So like, for instance, right now we're in the middle of what I call a deadline sandwich, which is on Monday, we had a posting deadline. So things had to be scheduled for a hearing in their second chamber by Monday. And I'm sorry. They had to be heard in their first chamber on Monday. And tomorrow we have a posting deadline where they have to be posted for a hearing in their second chamber by tomorrow. So that just shows you, Monday they have to have their hearing. By Monday, they have to have a hearing, and then by Friday, they have to be posted for another hearing. So things are moving really quickly as we go through this session. And as of today, we're officially over 50% of the way through it. So hooray for all those counting. I think we can go to the next slide. Okay, so this is session by the numbers from an OHA perspective. We as an agency touch a lot of different spaces that bills can apply to. So we track a lot of things, even at a low level. We use a priority system that's ranked 1 to 5, 1 being the highest priority, 5 being the lowest. So as you can see here, we are tracking so far about 142 bills, which make up 48% of the total bills that have been introduced to date in this session. And 29 of those bills we see as a priority 1, 28 a priority 2, and 57 a priority 3. When you get to priority 4, that's where you get the larger volume of things, where it's like we're looking at it, but it doesn't necessarily have a direct impact, but we're interested in the outcome of things. So you can see here a lot of work happening to prioritize and analyze bills so that we're making sure that we have input where we need to. Next slide, please. Okay, I wanted to give you all a few bills of interest that I thought may be interesting to this group. If there are other specific bills, I'm happy to talk about those as well after this. But starting with House Bill 4054, this has to do with the use of AI downcoding and making changes to regulations around that usage. And then House Bill 4098 changes the Unlawful Trade Practices Act to include things related to insurance. So we're watching this one really closely for our PEB and OEB plans, but it actually failed on the House floor yesterday, but we think it's going to have another vote today. So we'll be interested to see if this one gets it out of its first chamber. And then House Bill 4088, we call it the SHIELD law, but it's essentially protecting data related to reproductive health and gender affirming care. So it's setting up some new guidelines around that to protect individuals accessing that care. House Bill 4155 is related to infertility treatment services. This one actually went to Ways and Means because it has a fiscal from a different agency. Originally, we as OHA were watching it because it had a pretty significant impact on our PEB and OEB plans, but they were actually exempted out in an amendment. So I believe that the fiscal on this comes from DCBS, actually. But yeah, so it's sitting in Ways and Means. It hasn't been scheduled for a hearing there yet. But you may see things like that come up more after the second chamber deadlines pass. And then finally, I thought you all might be interested in Senate Bill 1527. This is a bill that we've seen 3 or 4 years now, and it prohibits cost sharing for exams and follow-up exams related to cervical cancer. And the bill itself actually aligns with federal requirements for this coverage because those came down. But the bill advocates wanted to ensure that we also had this protection in our state law as well. So it's really just aligning state law with the new federal requirements. So maybe I'll pause there, see if anybody has any other bills that they'd like to hear about or any questions. Yeah, Paul.
And this might be covered in our next topic, but I was just curious if there's any bills that the state-based exchange is kind of dependent on or sort of that need to happen this session to keep state-based exchange work moving smoothly and happily.
No, not this session. Thankfully, I think we're moving along, and we got the pop that we needed last session. So there isn't anything that the state-based transition is dependent on for this year.
Okay. Thanks.
Yeah. Yeah, go ahead.
Thank you. Hey, Beth. Quick question. I heard that the OHA and DHS are requesting $350 million together as part of the HR 1 impact. And I think OHA is getting about 100, I'm sorry, OHA I think is getting about 230 million. Do you know how those funds will be used or for what purpose or what departments to focus on it's going to be on?
Yeah, I can't speak too much in detail to that as it's not my specific topic area. I think that a lot of that has to do with the requirements in HR1 around continuous eligibility changes and also work requirements. I know that uh, we'll be in deeper conversations about those over the next few weeks with the legislative budget leadership, but I'm happy to get a breakdown of the specific things and share that with Chicky to share with all of you. But yeah, I think that primarily that's going to go toward those two initiatives. We also have the um, rural health transformation program within our purview, but that is largely federally funded.
Thank you.
Yeah. Next slide. I think it's just a question slide. Oh, here are some larger themes. Sorry. So I also just wanted to flag. So this session, healthcare actually, it's always important, but there are some sessions where it's more at the forefront than others. And I would say that this session, it's sort of taken a backseat to some other larger conversations that might not be surprising to you. A lot of them are in response to federal changes. So we're seeing a lot of things about immigration and law enforcement changes, like not allowing them to wear masks, not allowing them into specific facility types. We're seeing a lot related to education. And then I think the budget conversation largely circles around what we just discussed in relation to federal response. And then, of course, there's the transportation package. And for those of you that don't know, the bill passed last session. And then voters uh, collected signatures and got it on the ballot for reconsideration in November. There's a bill this session that would move that up to the ballot in May rather than in November. And so we actually just saw a walkout on the Senate side yesterday related to that bill. So it's sort of a developing topic. But these are some larger themes that I think are, in a lot of people's mind, overshadowing healthcare this year. So it's been interesting to see that happen. Next slide. Okay, that's the actual question slide. So maybe I'll just pause there and see if there are any other questions, or Chicky, if there's anything else that you feel like it would be helpful for me to talk about.
So Mary Beth, not necessarily related to this short session, but the long session is not too far away as we start preparing for that. So maybe after, if anybody has questions about the short session, maybe just give a preview of what that prep could look like for us for the long session.
Yeah, absolutely.
Looking to see if there are any other hands here. Okay, I am not seeing any. Thank you very much. I appreciate your time.
Yeah. And Chicky, do you want me to do that now?
Yes, please. Sorry,
Okay.
Lindsay. I did ask Mary Beth to give a quick preview of what prep could look like for the long session.
Yeah, I think I just got confused on the cadence we're going with, but yes, please.
Okay, thank you.
Yeah, so for 2027, it's a long session. It's about 6 months long. Agencies do bring bills during the long session, and OHA is currently working on developing the concepts that we're going to bring forward at that time. Right now, we're very much in the internal review and decision-making process. I always say to people, there's about 4,000 approvals between now and a bill being introduced. So everything right now is still very tentative. We will be submitting our concepts to the governor's office for review here in the next few months. And then by early summer, we should start our public rollout of what those concepts will look like. And we in government relations do what we call a roadshow, where we host a lot of public forums to talk about our concepts. And I'm happy to come back to this space and talk through those concepts when they're finalized as well. I will note that maybe unsurprising to most of you, we are in a very slim fiscal environment. So, I don't think that the agency is going to be looking for significant points of new investment, but really trying to think strategically about how we move important policy decisions forward at the same time. So, yeah, so hopefully more to come on our concepts in late spring, early summer. But yeah, that's where things are at.
Thank you, Mary Beth. Okay, sorry to jump from short session to long session. I know it's short sessions fast, but then long sessions also just around the corner, and that runway is pretty long as it should be. So, poor GR, I'm so sorry, Mary Beth. They're going to end one session and really jump into the prep for next one right away. So thanks again, Mary Beth. And so Lindsay, I think it's back to you.
Yeah, it's back to me. No, thanks. I thought you meant later, but appreciate that. And I guess with that, should ask one more time if there are any other questions there, because we covered more content. Okay. Oregon is definitely one of those states where it's never really done. There are days I'm jealous of Montana for that break, just for that reason. Anyway, okay, I'm not sure who is up first on Space Marketplace, but can you take it away?
Yep, it's Dorosita Martin.
Thank you.
Yep. So real quick, the topics today we'll be covering is just a quick overview of our implementation timeline. We'll be covering some key project accomplishments from the last time we've provided those updates. And then we will also be giving a quick overview of what our engagement was with our CMS partners. We have our feedback from listening sessions with the sisters and insurance agents. We'll be covering those details. What's on the horizon with insurance agents, sisters, and carriers. Branding update, as well as other upcoming community involvement opportunities. And then federal changes impacting the marketplace, and then looking across and on our watch list innovations in other SBM states. So quite a few topics here today. Let's go ahead and go to the next slide. So this should be a familiar slide for you. We are updating this as the project is moving forward, and I just noticed that our requirements is complete. So that actually should be so number 7 for conducting product orientation sessions. That has been officially completed, and now should be light blue. So we'll make sure to make that change. These specific requirements are specifically about the out-of-the-box requirements for the solution. Now we started conversations about the custom requirements. How are we going to configure the technology solution to meet Oregon's specific needs? So that work has begun this week as well. And it's planned to be, we have sessions planned through the first week of March to complete that work. In parallel, the other thing we did actually start working on, we did have a kickoff meeting for our CAC configuration platform and CAC systems. That kickoff meeting has happened and planning activities have started. In parallel, we also make sure to get those updated next time, but in progress for number 10 as well, conducting system testing and UAT. The work we did start is getting those quality environments available for us to begin that testing activities planned later in the future months. But that work has begun as well. Everything else is the same from the last time. Does anyone have any questions on the work to date? So things continue to move forward, and I can go ahead and go to the next slide. I'm going to cover some of the accomplishments that have happened for December, January, and February. So we do continue to receive project status reports. We've accepted and approved those from Get Insured. We do meet on a weekly cadence, and they provide them on a biweekly cadence to make sure that we have some formal status reports being produced throughout the project to inform all of our interested parties on progress throughout the project. And then we also have our UAT vendor RFQ. In December, we have released it. We are onboarding a UAT vendor to help us out with our testing on UAT to make sure we're doing a sufficient job in that area as well. We approved a deliverable, a monthly status deliverable. This is with our Blue Crane folks. They are our quality assurance vendor who is ensuring our project is being completed following our standard project management practices. So we did get their monthly status report approved in December. We also have approved the implementation framework plan. Again, another project status report since those are bi-weekly. In January as well, another status report. So you'll see those throughout, sprinkled through every 2 weeks in the months. And then we have we did complete a work order contract for an auditor to come in. That is a CMS requirement. We've completed our kickoff, but that contract has been executed, and we've already begun the onboarding activities to get them to start beginning those auditor activities to audit the system. CMS implementation connectivity was established as well, so there was some testing that was done with CMS and the connection between the system and the CMS connectivity has been successful and completed on January 26th. We also have completed the gap analysis. This is another CMS document that has been completed on January 26th, and we submitted it back on the 26th, and CMS did not have any follow-up questions for us. Conducted on January 27th, conducted reporting and analytics session. That is a specific session that was conducted on the 27th. And then we also did create a deliverable for a designated team. This is the point of contact. This is where we're identifying all the folks that are involved in the project. So everybody knows who's supporting what and who is supporting what. And then in February, this is where we completed all of the 25 product orientation sessions. This is the out-of-the-box conversations that we've been having with Get Insured and the program expertise. And then last, we accepted the carrier EDA test plan. This is a test plan that we'll be rolling out with carriers and making sure we do the proper EDA testing. Any questions? A lot of activities, and we continue to move forward. So any questions on these accomplishments? All right, moving forward. I don't see any hands. And this slide just covers how closely Oregon is working with CMS as we build out our state-based marketplace. So CMS, I think I've mentioned some of these in the previous slide, but real quick, just a quick overview. CMS has approved our blueprint, and I'm going back since we started the project. So all the activities we have done so far with CMS. So CMS has approved our blueprint. That was back in June of 2025. That is allowing us to move forward to build out the state-based marketplace. We had our CMS kickoff meeting in November, and we've been having weekly regular working sessions with focused on security, integrations, and testing. So a lot of planning activities happening and moving that work forward closely with CMS. And then we also have a signed legal data sharing agreement. We've completed that in December. In January, CMS provided technical guidance for connecting to federal services, and a secure network connection was established. So that was back on the accomplishment page, but that happened in January. In February, we received, we also streamlined the application. So that's the SSAP gap analysis that was completed in January as well. We also have submitted the computer matching agreement that was executed and sent over to CMS back on, I believe it was February 11th to be exact. And and then the testing plan as well. So continuous activities with CMS for building this solution. Any questions?
Not a question. I was just going to note that folks are rocking the acronym explanation in the chat. So if you haven't seen that, I would check that out.
Thank you for that. All right, if nothing more, I'm going to pass the mic over to Amy.
Thank you, Dorcita. Um, Good morning, everyone. Amy Coven here, she, her pronouns, and I am the Marketplace Communications and Public Engagement Analyst. Thank you for having me today. I just wanted to talk a little bit about some feedback that we've gotten from insurance agents and partners and some engagement that we are conducting with our enrollment partners as well. So since we last met, we have held 2 different rounds of listening sessions, one at the end of October, one at the end of January, both of which we held in conjunction and invited with Get Insured to come, and they presented at both sessions. The one in October featured an introduction to Get Insured, and the one in January featured a walkthrough of the platforms that were highly specific to the audience. So the January sessions, the assister session was for the assister platform walkthrough, and then the agent was for the agent platform. So really the feedback that we heard from our enrollment partners really centered around timing. There was a lot of questions and frankly some concerns about the short training timeline and launch during open enrollment. There was some questions about customer service support, how consent for assistance would work, how specifically for insurance agents assignment to consumers, and how referencing calls to the Consumer Assistance Center would work. Some questions about migration of data from healthcare.gov, security of consumer assignments to insurance agents. So in other words, how easy it would be or difficult for an insurance agent or a consumer to change a designation, whether through customer service or the back end. And then also some questions about the ability to save provider and drug formulary data that was entered into the anonymous browsing tool, so that it wouldn't have to be entered later if someone, for example, next year, let's say there was different plan options and they needed to compare options, they wouldn't have to re-enter all of their drug data and things like that in the future. We were able to work with Get Insured on the spot. It was really nice to have them at the sessions because we were able to work with them to get quick responses to all of these questions. We really didn't have to table anything or parking lot anything to get responses, which was great. And we did take note of all of the questions and we've gotten them up on our FAQs page. So if you're curious to see what was asked or what the responses were, really encourage you to take a look at our project site, and we have those all up there. I do want to just really quick mention that, especially when it comes to the questions about timing, one thing that we did address with our partners is that we are kind of bound to a short timeline, unfortunately, and a short ramp up, because we do have to wait until we get the green light from our federal partners to go live before we're able to really begin training and launch our system. So we will have a little bit of a short training timeline this year, but we do look forward in the future, future years, to be able to expand on that training timeline and offer a longer window, especially for our insurance agents, which we know are under a lot more pressure with Medicare running at the same time. Next slide, please. So what's on the horizon? We've got a lot of things kind of in the works and coming up that we're excited about. The first thing that we're kind of thinking about is our partner summit. We actually just sent out a partner survey, which was due yesterday, for all of our partners to fill out so that we could get some feedback on what they would like to see in the summit, and how many would be interested in attending and how they would like to attend. Just so we can kind of take their feedback into consideration as we're considering options and planning. What we're hoping to include in our partner summit is an option for in-person onboarding and training, a networking opportunity for all of our enrollment partners. In the past, our partner summit has really been concentrated on our grantee partners, but we are hoping to really expand on that, especially since we will be working with all of our insurance agents a lot more closely. so throughout the state. So we want to make sure that we're really bringing them in and making everyone feel welcome and know that we're here to support them. Of course, we want to give out all the policy updates that are important and relevant for this year, and then prepare folks for open enrollment, which of course is paramount. And the timing for the Partner Summit will really depend on when we do get that green light from our federal partners. We're hoping that that will come around the first part of August, in which case we're going to try and plan our Partner Summit for shortly thereafter and hope that all runs smoothly. But that is all still TBA and in the works. So we will be letting our partners know as soon as possible once we get things all on the books. Next slide, please. Additionally, we have some additional things coming up for our partners. So from August through October, we will have all of our onboarding and training started, which again will start as soon as we know from CMS that we are approved to launch. We will, as soon as we're given that green light, we will get our training launched. We will have a whole new updated training ready for all of our partners, which includes insurance agents this year. As you may or may not know, we have been training our assisters here in Oregon for a number of years, and we're excited to start training insurance agents as well. We've got a lot of really great feedback from our assisters, and we know, frankly, I think we know that our insurance agents are going to really enjoy our training as well. So we're excited to be able to launch that and to be able to offer some demos and things like that for training. We're thinking really intentionally about this type of support that we're going to be able to provide to support our partners during the onboarding and transition process, and what sorts of resources and tools will be available. And of course, we don't want to stop with onboarding. We will offer continuous training opportunities to reinforce all of the skills and proficiency that's needed. We always offer online and on-demand training options in English and Spanish, and then in-person training as available or requested as well. Those training opportunities do arise as there are changes in policies or procedures, but also we just offer general trainings on cultural literacy and things like that. So we're excited to continue to offer a wide breadth of training as well. Next slide, please. And then additionally, from August through November, and really available beyond November into open enrollment, we will continue to offer outreach tips and materials. We hope to share strategies for effective communication and engagement with our partners both before and during open enrollment, which includes a partner toolkit to be able to offer kind of plug and play, if you will, partner messages so that they can drop them into social media or newsletters, et cetera, to kind of promote open enrollment with their audiences. We will develop and distribute other outreach materials and messaging. We're thinking of things like posters or flyers that folks can customize or print out to make sure that messaging is really consistent and clear and everyone's talking about things in the same way. And then also we want to make sure that we are really helping folks think about their outreach in an inclusive way, that they're thinking about the strategies being tailored for different diverse communities throughout Oregon, and making sure that we're really trying to improve access, because one of the big goals that we have here with our state-based marketplace, of course, is to really improve access to coverage and to be able to reach communities more efficiently and in a more meaningful and intentional way. So we want to make sure that starts with outreach, and our partners, as Anadina and Michael mentioned earlier, are really paramount to that work. Next slide, please. And last, I think this is my last slide, for our insurance carriers. We do have a number of different things set up for them, from really that started back in November. So this work has been ongoing already and will continue to go through really through this year. What we've got going with them, we have started monthly meetings with our carriers so that we can make sure that they're ready and in the loop on everything that's going on from migration of information and connectivity testing and loading information and all of the different things. So there's a lot of different things that we have to work with our insurance carriers, but our carriers we found have been very excited to work with us. We've got really great partners with all of our insurance carriers, and I think everybody's just really excited for us to get going. So it's been a really great process. And next slide. Forgive me, I don't know if it's mine or if I'm handing off to Victor. Oh, one more slide. And then beyond, in June and beyond, we will move more into the production readiness and plan certification and display section with the carriers, where we are really moving more into that production environment, really thinking about how our plans are showing to our consumers, making sure that things are working properly, making sure that all of the plans that are certified are submitted and displayed properly, and everything is published and everything. So that will all be happening. Of course, we have our standard rate review process that will be happening this year, just like in years past. So we've got that kind of running concurrently with our partners over at the Division of Financial Regulation as well. Yeah, I see your hand.
Amy, thank you, Dorcita. I have one simple question. So when you're doing this, speaking on behalf of consumer, are they logging into healthcare.gov? And then when they go in there using their username and password, is it going to redirect them to state-based SBM, or they have to create a new username, password, and go to a new website? Thank you.
Yeah, no, that's a great question. Thank you for asking. So I can't give a ton of specifics because I know we're still working through a lot of the details, but what I can say is that healthcare.gov will send a notice once they determine that we are ready to go live. They will send a notice to all current enrollees, letting them know that Oregon is moving to a state-based marketplace. And then that will give us the opportunity to send a notice as well, inviting folks to come over and to start their account. I know that there will be some opportunities for folks to essentially claim their account. I don't know what that will look like for certain, so I don't want to speak too detailed about it, but I know they will need to set up an account over on healthcare.gov. It will be separate than the healthcare.gov system. And Chicky, I saw your hand go up and then I saw it lower. So I hope that means that I answered, I included everything.
You did. And I just wanted to add, so the healthcare.gov is a federal system, right? And then our system will be a state-run system. So the two systems just are completely different owners. So for the customer's privacy and security, we will need to have consumers create a separate account.
Then go get a form. And I say one more thing. So in that case, if yesterday we were in the meeting with Katie. So have you thought about using a third-party platform that has been so popular right now, such as Help Sherpa? Is it to be a middleman? That's going to make life a lot easier for us.
We've received those feedbacks for quite a while now, and unfortunately, at this time, we are not going to be using a third-party enhanced direct enrollment or direct enrollment partner at this time. We, of course, are also waiting further guidance and guidelines from the federal government in terms of their requirements for security and privacy. So there's been a lot of federal provisions regarding fraudulent enrollments. And all the security protocols that they would like to make sure SBMs implement. So for year one, we are not going to have an extra partner via direct enrollment.
Thank you, Chicky.
Thank you.
Yeah. I do have just a couple more slides and then I'll hand it off to Victor here, but I'll move kind of quickly. So just wanted to give everyone an update on the popular topic of branding. I know I'm for one very excited to launch our new brand, and we are still in that process. Right now, we are working, I should say we're waiting from the US Patent and Trademark Office for approval on our trademark. So once that trademark is received, then that brand will officially be ours and locked in. And we will also be trademarking with the state as well, but that process takes really no time at all. It's very quick. So we're waiting on that one until we have to wait on that one until it's actually active. Starting next month, we will begin planning our content strategy. Then we'll move on to production of our creative assets, which includes a photo and video shoot, so that we have assets that really fall in line with not only our brand, but also really represent Oregon and the people of Oregon in a truly authentic way. From June to July, we will really start doing our internal brand launch. Again, the exact kind of timeline and what that framework looks like is really to be determined. So can't really give a lot of specifics on that, but we will launch internally with our state partners, but before we're able to launch on an external level. Once CMS tells us that we are in that stage where we are ready to go live, then we will do our brand launch with our partners, which we hope to begin in August. And then our official public brand launch will begin sometime around October, again, to be determined. So this is kind of a rough timeline. Again, things are a little squishy, because things are in flux right now, but just wanted to give you kind of a high level overview of what to expect and just a little sneak peek of our color palette too. I wanted to drop a little Easter egg for you. Next slide, please. Lastly, I just want to show here some of the upcoming community involvement opportunities that we have, especially for our partners. We do continue to offer listening sessions. There's actually going to be a listening session also in January 2027, which is not shown here on the screen, but it will be happening. We have, as Dorcita mentioned, system testing, user acceptance testing that will be happening, our partner training, migration of data, and our rollout, and then of course going live to operations. And continuous partner support is really important to us. So we are starting to think about that now and what that looks like so that we can get our systems all ready and set up and in place so that we are fully able to support our partners in this transition. We know it's a big change. And on to your point, it's going to be a big change for our partners just as much as a big change for our consumers. So we want to make sure that we've got everything in place so that it's hopefully as smooth and painless as possible for everyone involved. So really appreciate the feedback and just continue to provide us feedback so that we can continue to improve our processes and help everyone out. With that, I am going to hand it off to Victor. Thank you, everyone.
Thanks, Amy. Hi again, everyone. Victor Garcia, Operations Advisor and Program Liaison for the Marketplace, Business Lead for our SBM project. Just going over some federal changes impacting the Marketplace that we have just a couple of slides. There's not a lot of content on there, but it represents like a small visible part of a very big iceberg that it sits on top of, and lots of work that went into distilling information to get to these. Just a couple of, we're already a little behind schedule, so I'll try to move through this quickly, but a couple of preface points here. One is that these are federal changes that kind of overall are just making life more difficult for enrollees and the people that assist them. I do want to make sure that that's distinct from the relationship we have with CMS that Dorcita described earlier. That's an active project engagement we have with some specific people, some of which we've been working with for a while. And those people that we've been working with have been nothing so far, demonstrated nothing but investment in our success in our SBM transition. So whenever we talk about these federal changes or things happening at the federal level that we're worried about, right now, that's not one of them. The people actually helping us make this technically happen from a CMS perspective are numerous and all very much on board. So we have no issues there and anticipate that going on into the future. So want to make that clear. And then also again, as we kind of talk through this, there is a lot more underneath, and it is a lot more sort of complex than these one or two lines that we have on some of these. So implementing these, we've thought about from a technical perspective and how we would maybe go about doing this, but scope containment for our current project is top of mind and kind of a priority. So when we talk about, again, some of the feedback we've gotten from partners, potential things we might do with that, some of these federal changes, potential mitigations we have for that, that's all within the context of we have a product with a vendor we have right now, Get Insured, that's working in other states. It's got a certain number of features. We have to be careful about the language we use, even saying things like customizing or making things unique to Oregon. It's all based on things that are already working in other places. And that is what we plan to implement in November. So there's nothing brand new that's going to require a whole lot of work to invent because there's just not the time for that. So if there's any concern about biting off more than we can chew or like we're not really saying any of that here. So those, just want to make those 2 points clear. We already know with very good specificity what we're going to be able to do by November, and anything that falls outside of that is going into our longer term strategic plan that you'll hear a little bit more about later. So with that preface, some of the changes coming from the program integrity rule last year, the following HR 1 that came, and then these do not include the most recent sort of draft rules for the next coming year, which is the notice of benefit and payment parameters. We'll probably be presenting on that at some later date. So there's probably more of these coming. And so jumping in, we have federal provision of, again, with the changes that came last year, removal of advanced premium tax credit repayment caps. That's for people that get tax credits, have an income change during the year. Ordinarily, there were safeguards in place so that, essentially, this happens most of the time as an accident. There's an income discrepancy. People don't update their applications, whatever the case might be. When taxes are filed, people maybe made more money than they said they made in the year before. That means they owe some of those premium tax credits back. And there was a cap on that, and that cap has been removed. This ultimately is a big concern for consumers mostly. It doesn't impact us directly at a technology level, but it certainly impacts how we try and inform consumers about this, about how important it is to update that income as soon as you can to make sure that doesn't happen, because that can be quite sticker shock come tax time. So want to try and avoid that. So clarify that information in the platform, send some reminders mid-year, and partnerships that we're exploring with Department of Revenue and others to periodically validate income, and we have other mechanisms to do that automatically. So checking that for people on a regular basis. If there's a discrepancy, we can send a message and then they can come in and update that in the platform. So no perfect solution for that, but those are the mitigating steps we can take. And those mechanisms are already in place. So that's nothing new we have to invent. And then moving on to the next, this one, again, I don't want to take too much time. We're already over, but this represents probably the biggest sort of problem people have understanding insurance. So I'm going to say this slowly, and most people probably still aren't going to have any idea what this means. Can you move back to the previous slide, please? Some non-citizens with incomes under 100% of the federal poverty level who have been in the United States for less than 5 years, called the 5-year bar, will no longer be eligible for premium tax credits. Most people have no idea what that means at all. And that's a lot of words strung together, but this just example the threading of the needle that it is to navigate our healthcare system, insurance structures, Medicaid, and all the other things together is just very confusing for the average person. So important why we always try and refer people to agents and community partners when we can to kind of help talk through some of the nuances of this. But this is essentially targeted at people, immigrants who have not been here for more than 5 years or more. There's a lot of programs that they don't qualify for, like regular Medicaid in most circumstances, and now no longer premium tax credits. So it just is an attempt to make insurance unaffordable for a segment of the immigrant population, and it does that pretty effectively. So we have some mechanisms to make sure our referrals to Oregon Health Plan are accurate, so that people don't spend too much time doing that. But also, if there are other programs that can fill in some of those gaps and catch some of those folks that may fall through with, essentially unaffordable coverage, that we direct them to those programs too. So again, a lot of mechanisms already in place for that, and then we'll just be refining them as we go. On the pre-enrollment income verification standards, this is the next item on the list here, and special enrollment period verification standards. This is just, we have sort of a higher threshold or higher requirements for vetting people when they're applying during open enrollment. We have to collect more information. More people have to provide more information on a more regular basis. So it just makes things a little more difficult for the people enrolling. And you'll see this a couple of times: maximizing flexibility under federal rules and leveraging technology. So what can we do to implement some automatic processes to make this easier for everyone involved? If somebody sends some information and it comes back that it isn't verified and they have to submit more documents or whatever the case might be, that takes more time, takes more effort, and whatever we can do to reduce that, you'll see that theme running through a couple of these. Next slide, please. Refugees and asylees no longer able to receive premium tax credits, similar to the 5-year bar, except this segment of the population has even less options available to them. One of the only mitigations we could potentially have is a state-based subsidy program. There are a number of ways we could subsidize either premium or claims if there was money, and Oregon is not exactly rolling in money right now. So, and that's not money that the marketplace has either. So it would rely on that, but there are mechanisms in place for us to implement that if that were possible. Shortened enrollment period, starting with 2027 enrollment period. Again, this is just a kind of a limiter on what was sort of a state option. So open enrollment, it was going through January 15th, and moving forward will end no later than December 31st. So we're exploring our options. Some of the states are looking at actually starting open enrollment earlier. That could cause a number of issues for a number of people, including a lot of our partners. So, weighing the pros and cons, and definitely getting feedback from partners and legislature, and also our, agents, community partners, all sorts of folks to see what their thoughts on other mitigating things might be. But for now, November 1st to December 31st is kind of the window, maximum window we're looking at. And then ending automatic re-enrollment starting in the 2028 open enrollment period. This is every year. If people don't go in and make any changes to their information, the system will just automatically re-enroll them in whatever plan they already had for that year. For a lot of people, it's just a set it and forget it kind of thing. And this has been painted in federal regulations, and some of the write-ups, the executive summaries on them is improper enrollments. So that's one of the patterns we've seen. You have talk about fraud, which is very important, and very important that we have steps to mitigate people making fraudulent enrollments to try and get away with something, and then quickly pivoting to improper enrollments, which really most of the time are a result of accidents. It's people that have signed up for one program, determined eligible, maybe with some information that was put in incorrectly. But again, we don't really see that as intentional most of the time. So a lot of these steps are reducing that ability to do a lot of the automatic things that make enrollment easier for people, under the premise of some kind of stopping of improper enrollments, which is, again, mostly mistakes people make trying to navigate an extremely complicated system with a lot of overlap and potential for just inter-system communication errors that can cause some of these things to happen. So implement some changes to, again, make sure we kind of comply with the law. Compliance is important, but also minimize disruption as much as we can to enrollees, and put mechanisms in place to try and alert them, that there may be something that needs correcting, or something of that nature. So lots of options we have, but again, compliance is important. We want to make sure the program stays in place, but also not necessarily being in moral alignment with a lot of these changes makes that difficult. It makes it important for us to try and put any mitigating pieces in place that we can to just reduce harm as much as possible. So lots of extra potholes being created. We'll try and fill them as much as we can to keep people from hurting themselves stepping in them, but a lot of them we just don't have the ability to fix completely because they are at the federal level. And then moving on to the next slide, last slide. Looking at other states, innovations in other states, again, this is keeping in mind our sort of current scope containment. So this is our, roadmap stuff that maybe won't be for this year. So easy enrollment being a tax filing, that's referrals from maybe the state revenue service where can be referred with information to the exchange to help people enroll directly from that experience. Same with unemployment insurance. These are the other states that have implemented those. Extended open enrollment period, obviously now very limited with some of the changes that are coming in. And because these other states are facing these same problems, we have dialogues in various forums with them to kind of collaborate, share ideas. Each state's laws and regulations work a little bit differently, but our goals as SBMs are aligned. We want to make enrollment easy and also want to make sure people have as good an experience as possible and an easy, smooth experience as possible. So how do we mitigate, those changes that are coming? Special enrollment period for pregnancy kind of feels like a makes sense kind of thing. Most states have chosen to when they can. Currently, you don't have a special enrollment until a new child is born into the family. A lot of states have said, well, if you find out you're pregnant, that should be the trigger for being able to get, coverage you don't currently have or changing your coverage. So we think Oregon probably would also want to do that and look forward to exploring that a bit more. And then the state premium subsidy program, as mentioned before, can help mitigate a lot of programs that are or problems that are caused by other circumstances, income, cutting back of tax credits and whatnot. But the money has to be there. So provided that there is some kind of funding source, we have the ability to implement a state subsidy program to help pay for either premiums or claims, depending on how that shakes out. So with that, I will stop. Again, apologize for going over, but willing to take any questions if needed.
I don't see a hand, but a question popped into the chat, although I'm experiencing a weird Zoom lag. So I just want to make sure.
Oh, I see a question. Yeah, about the 1332 waiver extension. So the waiver extension currently, Oregon has at least one in place for basic health program. And that is, currently sort of the an affordability measure. There's no extra money we can really get from a 1332 that isn't already present in the state. But if we were to do some kind of a program that would require most likely another 1332, we would just have to figure out where that funding is coming from. It's very unlikely to come from federal government, again, aside from the tax credits that are already available. So yes, and should that come to pass, that would be bringing it to places like HIMAC and others too, because that does require approval at a state level from various entities to push something like that through. So 1332 is the mechanism by which we can make some changes that deviate from a normal, marketplace practice, but it doesn't necessarily provide the money to make those changes happen.
Lindsay, can I ask questions?
Yeah, I would go for it. We're gonna have just a conversation in a minute around how we manage time and break, but please go ahead.
So I'd be quick. Victor, this is great information. What I really hope that there's going to be happening is to extended OEP. Give me the ideals, like, we have November 1st and we'll end December 15. And for all of us, the agents, we're so super crazy at that time. So let's say if I like begging you to say, hey, let's extend OEP to January 31st, and you say yes. In that case, people who don't know what SBM is, kind of later in the game come in, can they retro their effective date to be January 1st of the year 2027? I'm just talking kind of like out loud, kind of a dream, but I hope that would happen. Thank you.
Yes, you're absolutely correct. I think that's what most people who participate in the marketplace, run marketplaces, buy insurance from marketplaces, or people like yourself that help people would want to happen. The federal changes have made it so that we cannot extend open enrollment beyond December 31st. So it has to end December 31st, regardless of what we want. It's a change that really kind of helps no one. It was painted differently in the regulation executive summary, but I don't know that that necessarily fooled anyone. So it's really seemed to be targeted at lowering overall enrollment, and it will probably work for that purpose. So yes, people do need extra time to, especially after the holidays, to like explore their options and to really talk those through when maybe they just don't have the time or aren't thinking in those terms like in November and December. And that has been very valuable. And we've seen that help improve sort of enrollment outcomes. We'd want to push for that in the future. And as much as we hate for things to just change drastically from one presidential administration to the next, that's most likely what's going to happen. So the moment we are able to make that longer, we'll take advantage of that. We will push open enrollment out further from December 31st. It's just a bad time to end generally. It's New Year's. It's just not a great end date for that. But yes, I am in total agreement with what you said. We just can't do it right now.
Okay, I'm just trying to click through here. I think there's a question from the public, so I'm going to defer that to public comment. That works. Did I miss any other questions from committee members here? Okay. Thanks, everyone. And then before public comment and break, I think, Chicky, I'm handing it back. Am I handing it back to you? Hold on.
Lindsay, you totally can. So as many of us know, right? So we have Bill Kramer. He is an sitting member of the Oregon Health Policy Board. So the HIMAC is a subcommittee of the Oregon Health Policy Board, and Bill is our liaison / point of contact with the OHPB. I asked him real quick if he had some time to provide us an update or two. So Bill, if you are free, please take it away.
Great. Thanks so much, Chicky, and thanks to all of you. The marketplace plays such a critical role in providing affordable coverage to Oregonians, and the feedback and guidance from the advisory committee is really important to ensure the effective functioning of the marketplace. So it's great to participate and appreciate all the engagement from current and welcome to the new members. Just two quick things. One is the Oregon Health Policy Board priorities for 2026. One is affordability. We have formed an affordability committee and also an industry advisory committee that are charged with coming up with recommendations to improve affordability broadly in Oregon by this summer. And our request to all of you, we're looking for a person to fill a vacancy on the affordability committee. And that group is looking for an employer, probably a small or medium size or possibly a large employer. Many of you work closely with employers, and we would really appreciate any suggestions you have about an employer that you know, that you work with, who would be willing and able and contribute effectively to this affordability committee. They do not need to be experts in health policy. We can provide lots of background and helpful information. Just to bring the employer's perspective to this affordability committee's work would be tremendously valuable. The other priority for 2026 is primary care, which has come up a number of times during today's meeting, and more to come on that. Just one other additional comment, as listening to Victor's summary of the responses to federal changes, it's really important for all state agencies to do what's needed to preserve coverage for as many people as possible, and really appreciate the efforts so far. We saw that in that summary, the response to federal changes, and really reinforces also the importance of outreach and the ongoing communications with current and potential enrollees, working particularly with community partners. So I want to thank all of you for everything you do in your daily work to achieve that goal and your work on this committee. So thanks, and I'll stop there because I know we're behind schedule. Appreciate the opportunity to share this with the committee.
Thank you very much. I think we will head to public comment and then we'll take our break. Just wanted to flag there was a question in the thread for public comment. And Katie, thank you for your answer. Any other public comment at this time? And Dawn, is anyone signed up for today?
No, they haven't.
Thanks, Dawn. Okay, I'm not hearing any public comment, so I think we are shortening this break. So if we could please be back at 10:51, that would be great. Thanks, everyone. See you in a little bit. Okay, it is 10:51. As folks come back, if you could please just do us a favor, if you can turn on your camera so I know when we've hit kind of critical mass returning from break. And I'm sorry it's shorter, but we're fitting it all in, and I appreciate I see your note, Paul. Thank you. I appreciate folks asking questions and tolerating the shorter break. Thank you. Okay, I think we need to get rolling. Are we ready to kick off for proposed notice of benefit and payment parameters?
I'm ready to go anytime you are.
Okay, well, if you're ready, please take it away. Thank you.
Good morning. My name is Anthony Behrens. I'm a senior policy advisor and carrier liaison for the marketplace. I have the job of coordinating the response to the notice of benefit and payment parameters every year. This is a set of rules, proposed changes to regulations that we get from the federal government, typically related to, well, always related to coverage and rules governing brokers and agents, and setting parameters for the exchanges every year. So this year, it came out relatively late. Usually it comes out much earlier, like in the normally it would have come out like in the fall of 2025, fall to winter of 2025. And we just got it last week, so we are busy going through it. It's almost 600 pages this year. Not the longest, but not the shortest that we've seen. And we found out yesterday that we get 2 additional days to respond. We were initially told that responses were due on March 11th, but we found out they are not due until March 17th. Could we go to the next, or March 13th, excuse me, wishful thinking. Next slide, please. Thank you. So user fees for 2027. These are the fees that we have been paying for the use of healthcare.gov and the FFE. They are not changing. Additionally, the risk adjustment user fee is also not changing, so they will be the same for 2027. Our hope is we won't be paying that anymore, as we will be a state-based exchange. Next slide, please. Several, well, not several, a few provisions on agents and brokers, kind of continuing a trend we saw in the affordability regulation of last year, program integrity affordability regulation. There was some findings that agents in other states were sort of abusing the system to enroll consumers who weren't perhaps necessarily eligible for APTC, and also changing their enrollment to other plans so they could get additional commission. We have not seen this in Oregon, luckily. But so these proposed regulations sort of continue to crack down on these practices. So they prohibit rebating, which is basically an offering an inducement to enroll. This is already illegal in Oregon, so I don't really see it making much of a change here anyway. So it also prohibits falsely talking about, falsely implying that someone might not have to pay any money in premiums when they in fact might, and also making false statements about timelines and deadlines. Pretty sure these are probably also prohibited in Oregon anyway, so not sure what they'll do here. But could we have the next slide, please? Continuing on the theme of the kind of the crackdown, the feds want agents and brokers to use an HHS approved eligibility application review form, and they also want agents to use the HHS created consumer consent form for enrollment documentation. So that will be a bit of a change for this year, or for next year, excuse me. Next slide, please. So the feds are also proposing a new auditing program for state-based exchanges. This already applies for FFE states, and this is to measure the amount of improper payment of tax credits. It's a continuation again from what we've seen from the program integrity rule, again cracking down on this perceived notion that there are a lot of people getting improper APTC payments. The justification they use is that this is already required for the FFE, so we should try it for state-based exchanges as well, or implement it for state-based exchanges. Next slide, please. So this next slide applies to FFE states. It basically gives these states the option to conduct reviews to determine if consumers have adequate access to providers and or essentially essential community providers. If a state chooses not to do that, then CMS will continue to do it for them. Next slide, please. Next slide, please.
Anthony, we actually did have a question on the last slide from Charlie Fisher in the chat.
Yeah, I can't see the chat.
Yeah, it says, what would be an example of an improper payment? Thanks for jumping in there, Don. I wasn't sure when to, but yeah, this is for the prior slide.
An improper payment. So are we back to
Yeah, you're down
APTCs?
under. Yeah, you're
Yeah, I
down.
was just wondering what an example would be of a improper payment that's being audited here.
Would just be paying someone who's not eligible for APTCs, or paying a dead person APTCs, or paying a non-existent person or a person who doesn't live in the state, those types of things.
Got it. Thank you.
Yeah. Let's see, network adequacy. Okay. I lost my place. Okay. So with respect to network adequacy, there's currently a requirement that SBEs and SBFPs establish time and distance standards that are as stringent as the FFE requires. The proposal is to remove that requirement, and also to require that states ensure that QHPs provide sufficient provider choices. The justification for this is basically a deference to state authority and market expertise, and also a reduction in regulatory burden. Next slide, please. So with respect to essential community providers. It lowers the percentage of ECPs per service area that plans must contract with from 35% to 20%. Justification for this is to reduce regulatory burden on QHP issuers. And next slide, please. So the feds are proposing to allow non-network plans in the exchanges beginning in 2027. These plans must ensure access to providers that accept the benefit amount as full payment, and this includes ECPs and mental health providers. Next slide, please. So the HHS risk adjustment model recalibration, this occurs every year, and I really don't pay a lot of attention to it because this is something our friends at DFR respond to. We do a coordinated response with Division of Financial Regulation at DCBS, and so there are certain provisions, especially the math-heavy ones, that DFR handles, and we're very appreciative of that. Next slide, please. So I think it was last notice of benefit and payment parameters that they required that states transitioning like Oregon to full state-based exchange would be required to at least be a federally facilitated exchange on the, state-based exchange on the federal platform for at least 1 year. So this proposed rule is rescinding that requirement and just saying if you're an FFE, you don't need to take that extra step of becoming an SBE FP. You can just go right into being a full state-based exchange. And I think we're going to find out on the next slide why that is. So I believe that the feds are doing this because they really want to encourage states to get off the FFE and actually encourage states to use third-party sites like Health Sherpa and sites like that to run their exchanges. And that's what this proposal is doing. It actually allows SBEs to rely exclusively on these types of sites to run their exchanges. And that is kind of consistent with what we've seen with the Trump administration's approach to health insurance. And also we saw a lot of that promotion of these third-party sites during the first Trump administration. Next slide, please. So essential health benefits, this is sort of another proposal that reverses a recent change. Recently, EHB was allowed to include routine adult dental. This proposal would exclude that from EHB, so just a reversal of the previous administration's, one of their policies. Next slide, please. So another push we see on from the Trump administration to require states to pay for state mandates, and that's basically what this proposal is. It's just sort of a resurgence of that. We saw that in the first Trump administration. Next slide, please. Premium payment thresholds, this isn't a proposal. This is basically just a solicitation for comment. They're seeking comments on whether or not they should rescind these payment thresholds. And if they do, whether or not SBEs should be allowed to have them have the flexibility to still have payment thresholds if FFEs don't. Next slide, please. So this is basically an implementation. This proposal is an implementation of federal legislation, and also a rule that was stayed from the program integrity rule that was stayed by the City of Columbus versus Kennedy case. And this is the elimination of the 150% FPL SEP, and also the requirement that states verify 75% of all SEPs, make sure that they are verified and legitimate SEPs. Next slide, please. So this proposal is to eliminate the federal standard plan requirement. So the feds would no longer require states that don't already have have standard plans to offer the federal standard plans. This doesn't impact Oregon because we already have our own state standard plans. This provision would also eliminate the cap on the number of plans that the overall number of plans that carriers can offer. Next slide, please. So again, more implementation of federal legislation. This proposal limits APTCs and CSRs to citizens, and also to a new category called eligible aliens. This is a small defined set of non-citizens, so limiting the number of non-citizens who can obtain APTCs and CSRs. Next slide, please. So this is additional implementation of federal legislation. There's really no room for us to comment on these provisions because the rules have to change to comply with the change in federal law. And again, it's more limitation on non-citizens' receipt of APTC and coverage. Next slide, please. So this proposal requires requires consumers to verify their income if they are showing income under 100% FPL, and there are IRS data matching issues. So the information obtained from the IRS does not match what the consumer is saying, then the exchanges have to verify and get information from the consumer to ensure that the consumer is providing accurate income information. Next slide, please. So we recently had a change to the failure to file and reconcile rule. So this has to do with filing your taxes to reconcile that you're getting the correct amount of APTCs. The recent change was going from you had to do it every year to basically doing it every 2 years. Now the Trump administration is going back to the 1-year failure to reconcile requirement. So you have to file your taxes every year to get APTC. It's a further crackdown on what they view as improper APTC payments. Next slide, please. This proposal is just clarifying that HHS has the right to conduct audits of QHP issuers. Next slide, please. This proposal reiterates HHS authority to fine issuers for exchange violation. It applies when states aren't enforcing the requirements. Next slide, please. This proposal changes the quality improvement strategy requirements. So instead of focusing on specific strategies, this would allow QHP issuers to choose any 2 of the 5 strategies that are listed in the Affordable Care Act. Next slide, please. So this relates to silver loading. So this proposal would require carriers at silver load to provide data to the feds so that they could see how much this is costing them. They had asked for insurance commissioners for this information. My assumption is they didn't get a a very good response, so they're proposing to require it. Next slide, please. So this is kind of one of the bigger proposals. It's the sort of the reemergence of catastrophic plans. It's kind of a continuation of what we've seen from this administration, both in the first year and the second year. There's sort of preoccupation with sort of lower quality health insurance. The proposals would allow for multi-year terms and catastrophic plans up to 10 years. Next slide, please. And this this particular proposal would expand the eligibility for catastrophic coverage. So it would allow consumers who want this type of coverage to apply for a hardship exemption. And you can see there that if they're ineligible for APTC or CSRs because their income is below 100% or above 250% FPL, they could qualify even if they're over the age of 30. Next slide, please. So this just proposals related to annual updates, annual cost sharing updates. I didn't really get into that because it goes into the weeds. Next slide. And then this is not a proposal, it's just seeking comment on whether or not the Fed should, or what basically the impact of MLR standards are right now and whether or not Fed should amend them to sort of reduce the impact. I think that might be the last slide. Oh, yeah. So you are, anyone can comment on these rules if you feel strongly about them. You can certainly comment on them. For the most part, they're relatively, it seems like they could have been a lot worse. So I was actually somewhat pleased to sort of see what we got. But there's a link there for you to read the rules, and you can comment if you want. Again, the deadline is March 13th, not March 11th. I'm happy to take any questions if you have them.
I think there's
Kathleen?
Oh,
yeah, sorry.
Please.
Yes. Way back in your slides, that they're no longer covering dental for non-pediatric populations. Is there any way, I see links here for public comments, which is the best one to provide public comments on the disservice that is to the general public?
Yeah, maybe I should clarify a little bit. So the proposal is to not eliminate dental plans being offered through the exchange. It's to not allow those dental benefits to be included as part of essential health benefits. So under EHB, I think under the previous proposal, states were allowed to include them as part of essential health benefits, which would mean that if a medical carrier offered dental as part of the medical coverage, then the APTC could go towards that dental coverage. I don't think that we actually here in Oregon changed our EHB to allow dental coverage. I don't think we got to that point. And Katie would know better. She can jump in and correct me if I'm wrong, but I think we talked about it, but I don't think we actually got to the point where it was implemented. It was only in effect, I think, this year before they changed it. There still will be dental coverage allowed on the exchange as a separate policy. And obviously, pediatric dental will still be allowed as an EHB or required as an EHB under the under the medical coverage, medical, dental, mental. So yeah, hopefully
Is there a justification for separating those out since dental actually is essential healthcare and
the justification
directly
is that
correlates to medical conditions such as
the justification is
sepsis
that
and infected endocarditis if people aren't treated appropriately? So there is a lot of health medical consequences that can directly result from poor dental management.
the justification is that the essential health benefits was designed from the typical employer plan, and so the typical employer plan did not include dental benefits as part of the coverage. And so when EHB was designed, those were excluded as part of EHB. And so if EHB, if your benefits weren't included in a typical employer plan, small employer plan, usually, then they wouldn't be included in EHB. And so that's why dental wasn't included as part of EHB.
Thank you.
Any other questions?
I am not seeing any other hands, so I think we are good to move on to the updates in the workshop.
Okay, thank you.
Thank you very much. All right, Katie, I lost you on screen, but I think you're still here somewhere. There you are.
Sorry, I am here. Got to turn on the camera. Got to turn off the mute on all the things. Hi, everyone. I'm Katie Button. I use she, her pronouns. I'm the plan management and policy advisor for the marketplace, and I'm actually going to throw it to our contractor, David Simnett, to lead us through this presentation. David, please go ahead.
Right. Thanks, Katie. Really great to be with you all here today. Just by way of quick introduction of myself, David Simnett, as Katie indicated, working as a contracted consultant on sort of the strategic plan development. And my background is really in sort of health policy and public policy development and implementation. And working in executive leadership roles in state government, primarily around Medicaid, but partnering with lots of other payers and health insurance providers. So the reason that we're here today is to share early findings from the statewide partner survey, and then want to hear sort of reactions and insights from you all about how that's shaping up. So next slide. Sort of positioning ourselves, why now or why we're here. As you all know, obviously, Oregon's transitioning to a state-based marketplace. And really this work, the strategic planning work, is about sort of post SBM transition. So that transition and moving to an SBM really lays the foundation. But the focus of the strategic plan for this next 5-year period after this transition will define sort of what comes next and what those priorities are and how to implement those things. And we want to make sure we're involving you all and lots of partners to make sure that that direction is really informed by your experience and expertise. It's responsive to community needs, and that the goals and objectives that are identified are really practical and achievable and aligned across systems. Next slide. So just really quickly, I want to sort of use this as a visual to show you sort of where we are and where we're going in this development process. So as you all know, I think, and many of you completed the survey, we put together a survey for partners that was issued in January. It was open for several weeks. And that's really what we're here to talk about today. And we're doing this across various partner groups and meetings to sort of share those findings and get reactions. the same time, I'm involved in doing some peer state research to look at other states and how they're doing things and sort of promising practices, those types of things. And so we'll be going through the sort of development process, and sort of the high points here are in May. We're anticipating sort of taking all of this feedback that we've received and putting that into this draft framework to share back out with you, so you can kind of see like sort of the large plan. Won't be detailed yet, but it'll be sort of the large plan and be able to provide reactions and recommendations and guidance again. And from that, then we'll take all of that back, put together a detailed strategic plan, plan to have that out to you all for final review in August and September, do some final refinements based again on that feedback, and then sort of release that or publish that final with the October date. So really, what I want to drive home here is that we're really looking to involve you all early and often, and have sort of an iterative process so that you can help inform where the marketplace is going. Next slide. So the survey, and I want to move through this fairly quickly, and then we'll get to some sort of questions that I have for you to sort of see what you think and help us to put priorities together and figure out what to pay attention to, what may have been missed, et cetera. So I want to give you sort of the high level findings that we heard in the survey, and then get some reactions from you. Definitely, if you have questions as we go along, I'm going to move fairly quickly through this, but if something isn't clear or isn't making sense to you, please chime in so that we can make sure that we're all on the same page. So the top sort of themes that we heard across survey respondents are here on this slide. And you can really think of this as sort of the what. So things that partners are thinking areas where the state should be concentrating. And we're going to get to some of the how as we go along. But the top priority is really to simplify getting, keeping, and understanding coverage. The next, closely coming in next, is really strengthening affordability. This was really highlighted early across all income levels, recognizing that there's some differences in challenges, but the affordability is important. This integration across the marketplace, the Oregon Health Plan and the Bridge Plan, also seen very important. A lot of people talked about investing in culturally responsive outreach, making sure that those communities that you build trust in those communities and that they have good access. Next was enhanced tools and support for agents, assisters, and partners. And then really some comments and guidance about the platform itself and making sure that it is, when it implements, stable, intuitive, and respectful, and that the marketplace is actively continuing to support that and work to make improvements along the way. So sort of in a nutshell, really looking to build a system that actually works for people, simple, stable, and easy to understand. And this is pulled directly from one of the comments that was submitted in the survey. Next slide. So this next couple of slides are really looking at the how. So how do you sort of accomplish those things? And these are some sort of policy implementation ideas that were put in front of folks who took the survey to get the reaction about how important or not important survey respondents thought a particular potential policy enhancement was. And this first set are those that I would say are sort of in that top tier of things that people thought were the most important. And so for this first set, I want to go through these just in a little bit of detail to make sure that we are all on the same page. And then we'll go to the next slide here in a minute, and you can kind of look at those. But so the number one thing that people indicated is really having a simpler enrollment process for people who are no longer eligible for OHP or the Bridge Plan, and making sure that that is as seamless as possible, and that people don't lose coverage in between those events. Next was improvements to the customer service experience. And some examples were having or creating mobile-friendly enrollment environments, simplifying applications, and better search tools for doctors and medications. The third one there, using data to better reach and keep people enrolled, especially those at risk of losing coverage. And this is one that gets talked about a lot in terms of sort of one of the a primary benefit of sort of moving to a state-based marketplace is having more sort of real-time access to the data, to that marketplace data. Next is education to help people understand the health plans, including deductibles, copays, and really getting a good understanding of what their coverage includes and does not include. Next one is state-funded financial help to help lower premiums or out-of-pocket costs beyond federal assistance. So really sort of that affordability piece that people talked about in sort of that broader vision. And then the last one there is more support for insurance agents and assisters, things like training, grant funding, and helping them to develop stronger connections with community organizations or supporting that development. So this next slide, please, are also things that were on the survey that people were asked about. And were all of these really people indicated were important, honestly. But these are sort of that second tier, so also important, but maybe not as high a focus for the survey respondents as the previous set. And so this is really looking at changes to standard plans, easy enrollment options, so that you see in some other states around connections with DMV or tax forms, tools and education to help sort of that Medicare transition time frame go more smoothly. Having better language access and culturally relevant outreach, working with other programs to have sort of that cross communication across housing and food and other support programs where people may need but not have health insurance coverage, and then some looking at requirements for health plans to improve quality and advance equity. All right, next slide. So what I'm hoping to get from you is sort of your reactions to sort of how that looks, what's resonating with you, if you're seeing gaps in things that folks reported on the survey or that aren't captured here. What are those? And so these are just some kind of questions to get you thinking about that. But really wanting sort of your feedback on these. But which of these findings most reflect what you're seeing on the ground? Did anything surprise you? Are there key priorities that were missed?
Yeah, we've got a hand up. Please go ahead and chime in.
For your work and for the presentation, like a lot of great feedback. I actually have 3 questions. Let me know if it's appropriate or not, because or maybe somebody else can answer that, or maybe these questions are time for some other time. I don't know. So my first question was, you mentioned integration between OHP and Marketplace. And I was thinking about OHP and Marketplace applications because those 2 applications, they like ask different things. And I had an issue where you know how you apply through Marketplace and then you include your income, and Marketplace can suggest or automatically sends your application to OHP. The problem that I had was, I don't know, maybe it's because maybe because Marketplace doesn't include same questions as OHP does, but the problem is that a person, what was it? I think it was just like income like around $500 a month, and then Marketplace applications automatically sent it to OHP, and OHP saw that as I think it was you know how you get when you're not working you get what is it? Ugh, sorry, I'm spacing out. But basically OHP didn't see that as an income, and that it got so complicated, and OHP thought that this person doesn't work, and that it was like a whole, like a huge mess that it's now on person's case, which is like you can't really delete it. And like we talk to case managers, and they're like, there's nothing really we can do. So my question is, does that include like what you're doing? Does that include the better integration or better automation between um, basically two different applications, you know? Does that make sense?
Yeah, I think so. And I can take kind of a first stab at that, and then if some of the marketplace folks have other things to add, then absolutely should chime in. But I think it's really looking sort of generally or broadly at like where things aren't working, right? So
Mhm.
it's like, sometimes like the example that you gave, there isn't sort of this smooth sort of sharing of
Sure.
information or transition between those two, both from an eligibility standpoint and it sounds like even at an initial determination standpoint. And so, absolutely, as you see sort of those types of disconnects, then this would be an area that we heard from survey respondents that needs attention. And so, then the next step would be sort of identifying that as a priority, if it is, and then looking at what are the solutions for those things that you bring up.
Cool. Um, Second question, have you ever considered AI assistance? Like, I was thinking about maybe Marketplace has data of how many people apply with assistance, like with a navigator or whoever, or how many, or how many people apply by themselves, because there's still like a number of people who apply by themselves. And have you ever thought about integrating AI assistance for people who apply by themselves? And by assistance, I mean just explaining deductible again, co-pays again, and maybe just explaining how this plan works or why people should or like again, like comparing. Yeah, I know that Marketplace has a comparing tool, but sometimes it doesn't really help. And so, and like we're in 21st century. I know a lot of people maybe don't like AI, but like it is our future. It's already here. So have you ever considered doing AI assistance for people who are applying by themselves, just again explaining deductible, copays, and just improving health literacy in general?
Yeah, so I would say sort of we're in the information gathering stage, and so I'd probably turn this back to you in terms of like if you have experience or knowledge with AI, if that's something that you're seeing as having positive results.
I say it's worth trying, worth testing.
Okay.
Yeah.
Okay.
And my third question, oh, actually, no, that was all my question. Yeah. My question is that is there data on how many people apply with assistance with using health navigators or who apply on their own? Well, yeah, that's it. Thank you.
All
Paul,
right.
hand up.
Sure. And if you maybe hop back to that first slide, the top themes, it absolutely resonated with me. And yep, that one. Because I kind of see these all as different sides of the same thing. Like the top one for sure, simplify getting and keeping and understanding coverage. And, I think all of these bullets below that directly help. It's like, hey, how do we get all the folks that should be in the market and not make it maybe minimize the challenges at staying in the market, even as income changes, even as family changes. And so for me, at least, when I think about sort of the opportunity we have with the state-based exchange, it's, you know, helping people into the marketplace and keeping that population as broad as possible just kind of makes a lot of the other things easier. And if you flip to the next slide, again, kind of resonated with me of, all right, well, yes, how do we, help people as their eligibility changes? How do we get them better information? And I guess I don't know the hows to do these things, but it certainly resonated for if we can do these things, it feels like we're in a much, much better place in the coming years. So just wanted to share that nothing jumped out as a big miss for me, and what sort of was highlighted as those key themes and top priorities was just like, yeah, however we can do this, let's do this. So thank you.
Great. Thank you, Paul. So I just want to, it sounds like these things that are on the screen now, these top priorities, feel like they're in line with, they would likely or may have some good impacts on sort of those overall themes and improvements that people are looking for. Is that a fair statement from your viewpoint?
That is fair. Yes. Just it felt like, hey, this is the start of the right path. And a lot to learn, presumably, but trying to solve these things would get us to those key problems.
Great. Thank you. Other questions or thoughts on these?
This is Lindsay Hopper. I was just going to chime in to say that a number of the priorities resonate with other listening sessions we've had and other just public comment and other dialogue. All I was going to point out is just no surprise, a number of the priorities conflict or compete for resources, general affordability concepts and detailed health equity reporting on the part of a health plan. Those two things do conflict or constrain each other in some ways. So I know this is just a time for priority gathering and sharing, but recognizing where priorities conflict or compete, I think will be important going forward.
Yeah. So I think that's Don, if you can go to the next slide here. So it really is, it's a good segue, Lindsay, into this sort of next area, which is really looking at those priorities and seeing what you think should be at the top. And if there are specifics around sort of those things that you're seeing as potentially competing, I mean, obviously things that cost money are going to compete with other things that cost money. Same is true of resources and stuff. But if you can kind of think and HIMAC members think through, sort of look through these questions. So really looking at which priorities should the marketplace focus on first after the SBM launch. This would be, like year 1, year 2 type of stuff. Are there things that should be attacked early on in that strategic planning period? And then which of them do you think would have the greatest impact on consumers or partners? And where are the opportunities for collaboration? So, Don, if we can go back to those priority slides and people can kind of keep those questions in mind. One more, yeah. And so as you're looking at these, is there anything, and we can kind of toggle back and forth between those other important priorities too. Anything that you all would recommend sort of be focused on early, or that you think would be particularly impactful for consumers or other folks in the system?
Kathleen?
I would say educating the community would be a top priority for me, and the simplification of the platform, making sure that it's something that they understand, can see, and just under simplicity helps.
Great.
Paul?
Yes, so I keep forgetting to introduce, but this is Paul Harmon. On the prior slide, and it's probably aligned with Kathleen here, sort of that, I think it was 2, 3, 4. Just sort of, trying to get to the root cause of some of the challenges. And I think, support for agents, some of the state funded things, some of these other things absolutely would help too, but if we can first target, hey, with the new platform, with our new opportunity. And I also want to acknowledge that I know we try this every year, and healthcare is just so crazy complicated that we end up in the place where we're at. But for me, it would be 2, 3, 4 on the how do we do the education? How do we just help people not have barriers to even seeking coverage in the first place?
Great. Thank you, Paul. Any other?
There's a question in the chat around increasing the number of plans in the marketplace. I know a lot of us have thoughts about that and about why it's functioning the way it is today, but curious if anyone wanted to officially respond to that as well.
I can take that one. Hi, Alina. I do the plan certification for the marketplace, and for the last couple of years, we've had constraints on the number of plans that carriers have been able to offer in the market. Those are federal requirements, and when we launch our SBM in the fall, we won't have those constraints, so carriers can add some more plans. I will note that we are fortunate as a state to have 6 carriers. 5 of them are statewide, and then we have Kaiser that's in the I-5 corridor. So we actually have quite a bit more plan offerings in other states. And then we always kind of try to touch in with the carriers and see how they're doing and see what kinds of plans they want to be offering, if there's enough out there, if there isn't. And so again, we're kind of waiting on federal requirements to shake out, and I haven't had a chance to touch base with the carriers yet this year. But I do think that we probably will see a few more plan offerings in the fall once we're not limited anymore by the federal requirements.
And there's a thank you, Katie. And I think there's probably an answer there around the broader market competition that's noted that just reflects the underlying risk of this market right now as well. So I just from a payer perspective would acknowledge that. Matthew on the pink slide. Okay, slide 79. This is around the am I on the right slide? Slide 79? I think so. On OHP coverage ending and notification. Thanks for sharing that. Anyone have a comment there to respond?
This is Amy. I would love to jump in really quick if I may. I actually had a recent conversation with some folks from the OHP member communications team about this, and they've been doing some research on the communications that are sent out and who is getting what communications and what's being opened and things like that. And some of the feedback that they're receiving is that folks are actually receiving letters, but they're just not opening them because they don't realize that they have OHP, or they don't, they're not thinking that it's an important letter. And so I've been having conversations with them about, how can we make those notices more apparent as to what they are, and if there's anything that we can do kind of cross-functionally once we have our state-based marketplace to communicate more precisely or in better language with folks so that they understand kind of what's going on and what the next steps will be. So hoping that will be the case. Definitely know that this is a common issue, and hoping that we'll be able to kind of smoothen that process a little bit.
Thanks, Amy.
Amy, I think Charlie, you're up next.
Yeah, thanks. This is really exciting. It's amazing to see this, about to actually happen. And so I have 2 thoughts kind of related to each other. The first is, I think for me, the priority should be having a platform that is as consumer friendly as possible and lets people is like a one-stop shop for everything someone might need, and explains to them the choices that they have. Just like the fact that we have more flexibility should allow us to provide a much more tailored consumer experience for Oregonians. And then second, the other benefit that I've always seen from this is just that we get so much more data. And so kind of planning from the beginning to use that data to tailor the experience further. So like are there certain things that people are searching really frequently? Um, and whether it's like a particular drug or searching for doctors or I don't know, whatever the thing is, and then use that information both to maybe make changes to the website, but also uh, come up with maybe things that we would want to include in like a new standard plan that would be more responsive to kind of what people are looking for. Um, so, anyways, those are my two thoughts.
Great. Thank you, Charlie.
I had my own hand raised. I was just going to speak briefly. I think we are going to run out of time, and there's, I think, a need for more discussion here. So just probably a request for Chicky and team to kind of take that back and consider. But in terms of priorities, from a payer perspective, I know there's a lot of opportunities for input, but I think I see the highest priority is minimum viable product functioning on time before we pursue broader variability or tailoring or additional reporting, some really clear stage gating that I would just see as most critical priority. The next one I would look at around a consumer access and understandability is not a word, but consumer experience there. And again, before pursuing more variability and more tailoring, I just wanted to say I really liked Paul's comment on understanding root cause, because, for example, taking this my own direction, one of the top policy or priorities flagged here is education to help people understand plans, deductibles, copays, and what coverage includes. All of that exists today. I think if there's ongoing we have ongoing observations about perhaps the ineffectiveness of that or the inadequacy of that, or the end result is still not what we want and consumers want. So I would caution against the more of until we have perhaps a better understanding of root cause or more effectiveness. Again, trying to balance minimum viable product, timeline, effectiveness, and the overriding affordability concerns. Kathleen, your hand is up.
Yeah, another thing that kind of came to mind when Charlie was speaking is the customer service element to it, making sure that they actually have a live voice to speak to and not these AI phone trees that take you into the land of never, never, so that any individual can find somebody to answer their questions. It is a source of great frustration, and especially, for English as a second language, or people like me who are impatient. That's just adds this layer of frustration that may limit our customer base accessing this platform, and they are probably the people who would need it the most.
Great. Thank you. So, I'm sorry, Lindsay, were you gonna?
No, I was just thinking, Kathleen, and I was looking for other hands in the chat. I don't see any right now. I do see Amy's response in the text. Thank you. Sorry, go ahead. I didn't mean
Yeah,
to.
no, this is the last slide really, really looking on, how you want to stay involved. I think, Lizzie, you talked about, having additional conversations like this. And if there's anything else that y'all would like to point out, then that'd be helpful at this point.
Yeah, I certainly can't speak for the whole group, but I would guess if we had 45 more minutes, we would use those 45 minutes. Would sort of be my take about, there's just a lot of opportunity here, but I really am curious about feedback from others on the committee about further engagement or other thoughts even about the content here today. Especially if someone hasn't had a chance to speak up, who would love to. I would really love to hear from you. I see a hand up. Go for it.
I was thinking, how people ask, like, how would you like to stay involved? But then my question is always like, do you have any suggestions or already something in mind that you need help with? Or how you want people to stay involved? Because like probably you're asking because you're already having some needs or ideas.
Yeah, I mean, I think it goes back to sort of that framework that I shared at the beginning in terms of where we have identified these sort of connections with partners as we go through the process. So the next sort of identified step is around that framework. And if having, sort of opportunities for people to submit things in writing, I think this is sort of what we're envisioning. And in sort of forums like this that already exist, where we can connect with folks to talk through questions and issues. So if there are other things, and I think there's a commitment in the market with the marketplace folks to do that. If there are other things that you all think could be helpful, then definitely, would love to hear about that as well.
Thank you. Do others have thoughts? Would you welcome a part 2 continued conversation at our next meeting? I know that's implied in some ways based on the development process, but other thoughts?
Quickly.
Yeah,
Thank you. Yesterday, David, you heard a lot about us agent, and I responded to your survey too. We focus so much on the simplify the process and cost. I think the involvement that I like to be involved if we can be part of the plan benefit designs. Because, for example, this year, we take a look in the slides earlier of this meeting that you see that even the bronze plan, that we have quite a lot of dropout, not people enroll. So people need to see, and as agent, explained about deductible co-insurance, maximum out of pocket multiple times. But when at the meeting, people were so scared about how much I have to pay. So if we have the plan benefit that right along with the cost, they're willing to pay. So if that's, I don't know, is in your scope or not, we should be able to help with the plan benefit designs and, go back to the insurer and see if that's possible. That's my comment. Thank you.
Thanks so.
Anyone else have feedback today? Okay, I'm not seeing any other hands raised. Okay. Do you think there's significant interest in ongoing engagement? Would be fair to say. Looks like to me.
Thank you all very much. Really appreciate the opportunity to come and speak with you today.
Thanks for being here and thanks for sharing the early themes and priorities. I think we're at our second of 2 public comments. I don't know that this one is on the agenda, but this is indeed time for additional thoughts from the public. Anyone signed up or anyone want to chime in?
No one has signed up.
Thanks, Dawn. Okay, not seeing anything there. I love this note of appreciation and thank you to Gladys. Chicky, was there anything else you wanted to offer here? Oh, unless it's just me, I am not hearing your...
It is not you. It is definitely me because there are 3 ways to unmute yourself and I forgot one. So my apologies. So only to thank Gladys for her 4 years of serving as a HIMAC member. She is not here with us today, but we still want to publicly acknowledge her and thank her for all the time and energy she has spent with the committee. And she's still a marketplace partner agent. So we will it's definitely not a full goodbye, but at least it's a full goodbye for the HIMAC side, but she's definitely still part of the marketplace family. So thank you, Gladys. You're not here, but we are sending good vibes your way. And this meeting is recorded, so we'll be happy to make sure to give you access to all of the materials.
I love the reactions and the thank you to Gladys. Okay, I want to just thank everyone for sticking with it today and for devoting your time, and thank you to all of our presenters. Next meeting listed here, April 16th. Chicky, anything you want to offer here on this one? Anything else we need to know?
Yes. So our April meeting. So if you all, well, for those who were active about a year or so ago, we surveyed the committee about which date within the year you all would like it to meet in person. So the goal for our April 16th meeting is that this will be an in-person meeting over at our HSB location in Salem. So if you can please make it then, that would be fantastic. Of course, we'll also still have a virtual option for those who absolutely cannot make it, but we truly encourage everybody to join us for our once a year in-person meeting. We will be in touch with, of course, other logistics for that in-person collaboration. So looking forward to seeing you all in April for sure.
Awesome. Okay. Thanks very much, everyone. I hope you stay warm and healthy and hope to see you in person in April. Take care.